categories of symptoms, let's talk about how we use those to look at these subtypes of schizophrenia. The first subtype of schizophrenia is paranoid schizophrenia. This is marked by high levels of suspicion, particularly suspicion that someone is trying to hurt them. There is at least one delusion present, and usually the symptoms that go along with paranoid schizophrenia are those positive symptoms, often auditory hallucinations, right? So hearing things that aren't there. The next subtype of schizophrenia is disorganized or Hepaphranic schizophrenia. These are primary disorganized symptoms, as you probably could have guessed. And a lot of times what goes along with this is that flattened affect. So again, blank emotional face, no emotion or fluctuation in the tone of voice, or that inappropriate affect where they're expressing the wrong emotion in relation to what they're feeling or the current social situation. The third subtype of schizophrenia is catatonic schizophrenia. We don't really use this one so much anymore. As our schizophrenia treatment started getting better, we realized the rates of catatonic schizophrenia going down. And a lot of people came to realize that catatonic schizophrenia was probably mostly the result of long-term untreated other forms of schizophrenia. So again, we don't see this one as much, but it still is important to understand what that phrase means because again, catatonic or catatonia is a buzzword that we throw around a lot when we're talking about schizophrenia. So this usually involves exaggerated movements that are either positive or negative. So they can be mostly immobile or rigid and just like not moving, or it can be excessive movements. These excessive movements can include mimicking the movements of others. So like if they're in a therapy session and the therapist tends to talk with their hands, they will be mirroring that and moving their hands along with them. The repeated rocking, right? That stereotype, if you've ever seen movies that picture people in an inpatient institution and there's just the people sitting in the corner quiet and rocking, that would be another example of this. And a lot of times this will also affect their speech. So they'll do something that we call echolalia, which means when they talk, their speech may be highly repetitive of what others around them are saying. So you say something to them, and instead of answering the question you ask, they just repeat the question back to you. And they keep repeating it over and over. Now, as with all diagnoses, we also have an undifferentiated category. A lot of the other diagnoses will do this as NOS, or not otherwise specified. In schizophrenia, we call it undifferentiated. This means that there definitely are schizophrenia symptoms going on here, right? If you look at all those past categories of symptoms that we just talked about, those symptoms are there, but they're not happening in a pattern where we can say they're mostly positive, they're mostly negative, they're mostly disorganized. They're not occurring in patterns where we can fit them with paranoid, disorganized, or catatonic. And the symptoms can fluctuate in terms of, is it mostly positive? Is it mostly negative? So it's just, there's schizophrenia symptoms, but we can't really categorize it. And the last category is residual. What residual schizophrenia means is that there are not currently any prominent delusions, hallucinations, or catatonic behaviors, but they may still be having a little bit of them in terms of odd beliefs or distorted thoughts. And they often will still have those negative symptoms happening under the surface. So they might not be having the active auditory hallucinations where they're hearing voices that somebody is trying to kill them, but they're still having a little bit of a delusion that people are out to get them, that something is wrong, that there's secret messages, and then they're having those negative symptoms to go along with that. So now that we've talked about the subtypes, we need to address the idea, I'm almost out of time for this video, so I will stop, and our spectrum disorders will be on the next video.